So today we will be talking about osteosarcoma. So what is osteosarcoma? Osteosarcoma, or what we so call osteogenic sarcoma, abbreviated as OS, is a type of bone cancer that begins in the cells that form bones. And when we say form bones, that is the bone forming cells, what we so call osteoblasts. Okay? It is the most primary malignant tumor of bone. The tumor is derived from malignant osteoblasts that synthesize bone. Osteosarcoma is most often found in the long bones, so the upper and lower extremities. For example, the humerus, the femur, the tibia, and the radius. So more often, it is found in the legs, or it occurs in the legs, but sometimes in the arms, but can start in any bone. In very rare instances, it occurs in soft tissue inside the bones. Okay. So, every year, there are 1,000 cases, and 450 of them are children and teenagers. So, some of these symptoms, or what happens when you have osteosarcoma, is that you have a weak bone matrix, and occurs most commonly in fast-growing locations like the proximal tibia, the distal femur, around the knee, and the proximal humerus. Historical perspective of osteosarcoma. In 1805, a French surgeon, Alexis Boyer, was first described the term osteosarcoma. In 1847, Guillaume Dupuytren had a true description and natural history of the process. In 1854, Hermann Lebert was the first histologic description of the bone tumors. Pathology. Osteosarcoma of the bone is a tumor composed of malignant cells that produce steroid. Some tumors show predominant chondroid and fibromatoid ground substance. All, however, are highly malignant, and about 80% produce death with metastasis.
So, hello, my name is Gia, and I will be discussing the cause of osteosarcoma, how it was acquired, and symptoms that you are possibly in a high risk of having a bone cancer called osteosarcoma. There are potential risk factors, and this includes firstly the exposure to radiation, or for example, you are being treated with radiation therapy for several years. Another one is bone infarction, or this means that it occurs when blood supply is cut off from the bone tissue, where it kills the bone cells and cause damage to your DNA. Another high risk of osteosarcoma is when a child or adolescent is going through a growth spurt or a rapid bone growth. And lastly, habit and lifestyle factors such as stress, diet, lack of physical activity, tobacco use also take a big role to high risk bone cancer, specifically on osteosarcoma. Another symptom is swelling in the area, limb pain, a bone injury, or break for no clear reason, and symptoms that include severe localized bone pain, that is throbbing, stabbing, aching, excruciating, and severe bone fracture, that may be a high chance that you have an osteosarcoma. So if you have any persistent signs and symptoms that may worry you, better to have an appointment with your doctor. Thank you.
Hi guys, my name is Marco Angelo G of Zoom. How osteosarcoma affects the body? The outcome is an accumulation of malformed bone cells or a tumor that can be penetrate and harm good bodily tissues. What are the most vulnerable age, gender, and cultural group to osteosarcoma? The most osteosarcoma occur in children, teens, and young adults between the ages of 10 and 30. Teens are the most commonly affected age group, but people of any age can develop osteosarcoma.
Osteosarcoma. So, can osteosarcoma be cured? Today, about 3 out of 4 people have osteosarcoma can be cured if the cancer hasn't spread to the other parts of the body. Almost everyone who is treated with a limb-sparing surgery ends up with that arm or leg working well. Many people who have osteosarcoma will need physical therapy for several months after surgery. Osteosarcoma treatment physically involves surgery and chemotherapy. Radiation therapy might be an option in certain situations. Some of the imaging tests can help the doctor investigate the bone symptoms. Look for cancer and look for signs that the cancer has spread. These are the types of tests. Includes X-ray, computerized tomography, magnetic resonance imaging, positron emission tomography, and bone scan.
Just like Ate Maureen said earlier, osteosarcoma is treatable if the cancer or the tumor itself hasn't spread to the bone. So let's proceed to the last method of our reporting. The last method of our reporting is what is the best method to help prevent the development of osteosarcoma? Well, or I should say we can prevent or reduce the risk by making healthy choices. Like, we have 4 healthy making choices. And the first one is keeping a healthy weight. Make sure we are exercising at least twice or thrice a week so that our body are healthy or on track so that we can prevent or our bone can be strong enough to prevent having osteosarcoma. The second one is avoiding tobacco. Avoiding tobacco can mostly cause cancer through the throat, but it can also help osteosarcoma widen or spread to the bone. The third one is limiting the amount of alcohol you drink. Actually, I don't know if this is really considerable because the alcohol itself is just going to our stomach, not in our bone. But if alcohol is the main or at least one of the causes, I think we should really avoid it. But if you are really a drinking person, who always loves to drink, not me, pero someone, we can drink alcohol moderately. Like, we can drink alcohol whenever there is an event or your birthday or an occasion like Christmas or New Year. We can do that, but not every day. We cannot drink alcohol every day just like we want to. The fourth one or the last one is protecting our skin. Well, this is the trick one because osteosarcoma is in the bone, right? But we need to protect our skin because of the sunlight. The sunlight or the UV rays can hurt our skin or irritate our skin by its incredible heat. Pero as I researched it earlier, protecting our skin is one of the major reason to prevent osteosarcoma. Once again, this is the group of osteosarcoma.
example, being treated with radiation therapy.
I just woke up, so it's time to make the video. Bye-bye.
Or I should say we can reduce the risk.
Osteosarcoma.